As Nigeria's economy continues to struggle, private hospitals, which cater to the majority of citizens, are feeling the pressure. Soaring cost of drugs, electricity, and medical supplies are pushing many clinics to brink of collapse. Abdulazeez Ibrahim reports from Kano on how the economic downturn is threatening access to private healthcare. His report.
Private hospitals provide care for nearly 70% of Nigerians, bridging the gap left by overstretched public facilities. But today, these hospitals find themselves trapped between rising operational costs and patients who can no longer afford treatment.
In 2020, then a liter of fuel was about 100 and something. Today is almost 1,000 naira. So that alone has skyrocketed so many things in the market, especially the prices of goods, drugs, consumables, running cost of the clinic. Like now, we are running on solar. Just imagine that I was not running on solar presently. Imagine running on diesel, because you need to power the air conditioners, other things you need. It will triple the price of the services.
For residents, the impact is equally severe.
If you observe today, before you roll down from one street to the other, you see roundabouts, several patent store shops. Why are they doing that? Is because people get so scared to go to the hospitals. You understand? To the private, they know it's expensive. To the government medical institute, it takes a lot of time before you get what you want. And even when you get it, you won't be satisfied. So people just believe in self-medication, which we all know that self-medication is not safe.
In the past, if someone had malaria or fever or a headache, they might be charged about 700 or 1,000 naira. But now, it could cost as much as 10,000 naira. Life these days is not easy. For private hospitals, you must have enough money before going there. That's why we always plead with the government to upgrade public health facilities, especially for people in rural areas who are facing serious challenges.
Let me say admission was like 15K, but now it's as high as 50,000. And most people cannot afford it, especially civil servants. They can't afford it. So most people prefer to patronize the roadside chemists. They now go outside, or most of them do self-medication. They patronize the herbal side of the orthodox medicine. Before, if the case is very worse, before they come to the hospital.
Experts warn that the situation calls for urgent reforms, including expanded health insurance coverage and targeted support for private healthcare providers. Without such measures, both hospitals and patients may continue to bear the brunt of Nigeria's deepening economic crisis.